A very good evening to you watching UBC TV. My name is Sophie Matovu. Thank you for joining me on U Health Chat. Now, tonight we are going to talk about physiotherapy for lower back pain. There are certain times some of you have a misconception and you think lower back pain is for a specific age bracket. This problem can happen to you at any time, irregardless of the age. But I'm not the expert like I normally tell you when it comes to these issues. With me in studio is Yiga Robert, who is a proprietor, a director, a physiotherapist of, you called it a Rolin? Yeah? Lorian, actually, it's Lorian. It's a name of two people. I won't tell you who the second person is. And he is a physiotherapist as well. A very good evening to you, and thank you for making it for the show.
Good evening, Sophie.
Yes. Now, we would like to start by you helping us to define, because I'm very impressed that you've been able to come with a demo, something that will physically, the spinal, that you'll be able to use to take us through the whole process. What's the difference, to first start with, between massage and physiotherapy? Let's open up the show at that note.
Yeah, it's a privilege for me to be here this evening. And I'm excited that we are going to discuss this important topic. But like you have said, for me to distinguish between physio and massage, physiotherapy is a health care profession. And for you to become a physio, you must have gone to a college or a university, studied for some years to get an award. You have to be licensed by the Allied Health Professions Council under the Ministry of Health. And you must be certified by the Uganda Association of Physiotherapists. Massage, to us, we don't even call it massage. It's a manipulative technique. It's a pinch of one of the treatment modules that we use to treat musculoskeletal challenges, like low back pain. And physiotherapy, in its sense, it's a healthcare profession that deals with human function and movement and maximizing physical potential in human beings, of course. Yeah.
So I know for some, at least when I had a conversation with you earlier, you clearly indicated to me that lower back pain seems to be like one of the major challenges some people are facing. Now let's first get into what are the causes of the lower back pain based on your assessment of the people you normally see.
Like you have stated when we are starting, back pain, low back pain can happen to anyone at any age, be it adolescents, be it our senior citizens. But back pain, low back pain is pain that radiates from the lower ribs to the gluteal folds, which we call the butts. We are talking about this pain here, the pain that is centered here. The pain that is centered here. And some of the cause, why low back pain? The lower part of the back, which is the lumbar region, we call it the lumbar region in medical language, is composed of 5 bones, which we call the vertebral bones. It's highlighted in green here. There are 5 bones.
Green ones here.
And it's the mobile part of the back. It's the mobile part of the spine, and it's the part of the spine that carries our upper body weight. So it's mainly affected by the things that we do, like posture, sitting for long hours, pregnancy. I'm not saying that people should not give birth, but pregnancy, aging, physical activities, so many things. And it's mainly, the most common is non-specific low back pain. By non-specific low back pain, I'm talking about back pain that cannot be, it's of unknown cause. You cannot relate it to pathology. You cannot say that probably someone has cancer, then it is the cause of the back pain. Someone maybe has a lung problem, it's the cause of back pain. Maybe someone has gotten an accident, so you can't relate it to anything. So that's 90% of the low back pain is from that.
Wow, that becomes worrying when you say that the majority of the back pain is from non-specific
causes.
So there are certain times now, how do you deal with that? Because sometimes doctors will possibly give you a painkiller to be able to manage it. Am I right, or am I
Yeah, you know, many times when you go for medical checkups, ideally you go there because you feel pain. Pain is not a disease in its sense. It's a symptom. It's something to tell you that you have a challenge. So you seek medical interventions. And physiotherapy is a hands-on treatment. It's not limited to pharmacological management. It's not limited to medicines. And it's important for people to appreciate that painkillers should not be seen as first-line treatments for low back pain. They are painkillers. So they are there to help you manage the pain, but they are not treating the problem. For you to appreciate how back pain can be managed, it's important that you are seen by a team of professionals, that those are the physiotherapists, and they are able to assess you. And when they assess you, they will be able to diagnose the problem. So even the treatment stems from your diagnosis. I don't know whether I'm making a point.
Yes, you do.
You have to be diagnosed. And for us, when we are diagnosing, there are different maneuvers. There are different tests that are available for musculoskeletal assessments. So it could be, I can just tell you to bend your back and you complain. I might just tell you to take a certain sleeping position and you complain. I might just tell you to raise your leg and you complain. Now, when I'm taking you through those maneuvers, I'm trying to identify the possible cause of the low back pain. Like I've said, the low back pain is made up of 5 vertebral bones. And we are talking about pain that is underneath your ribs to the gluteal folds or to the butt, the buttocks. So sometimes it radiates even to the leg. Pain radiates to the leg, but that is when the nerves are involved. That are, because, I mean, nerves that are supplying your legs are stemming from your lower back. So they form one big nerve called the sciatic nerve. Now, the lower back is made up of bones, made up of muscles, made up of ligaments, it's made up of nerves, made up of tendons. It's important to appreciate that any change, any injury or damage to those structures, the discs or anything, can be the source of your lower back pain. So the reason as why I'm saying it's non-specific, not until you have been diagnosed through the different maneuvers that we take you through. So we are able to know, and depending on the way you narrate your problem, so there's the way the symptoms are presenting, so we are able to know. Yeah.
Wow. Okay, now, because my specific interest, like we said, is this specific area.
Yeah.
Because one, it looks very sensitive.
Yeah.
If by that time my all upper weight, which is this, is supported by this,
yes,
what does that communicate? This seems rather delicate. You've talked about the discs here.
Yes.
And I'm seeing if you have a scenario where they dislocate.
Yeah.
How do we go about some of this? Because there are certain times we had this tendency. Remember, you're much younger, of course. For us as we were growing up, and then your parents had a problem and they're complaining of a back. Then they're like, come and walk. They lie flat and they're like, do a bit of stepping and massaging. And you know, the whole thing, it feels a little bit, I think, better for them.
Yeah.
So how do you go about it, dealing with this sensitive part?
Yeah.
Because I can imagine if people try to tamper with it, any of this can shift position.
Yeah, it goes back to the different conditions that are causing the back problem. There are different conditions, and for the viewers out there, I beg to use the medical terms. I didn't want to be using them, but there are different conditions. And those different conditions require you to be very disciplined in handling them. We have a scenario, like I've said, the different structures. If it's a bone sleeping against a bone, the lower vertebra, this one, slides forward.
Out of position?
Yeah, it can slide forward for people that do a lot of bending activities. It can slide forward, which we call spondylolisthesis. Now, for you to come and say, step on my back, it's deadly. Our mothers, our grandparents that you're talking about, you have no idea of how many people suffered and died because of that. We don't, there's no data to relate to that. I'm not saying many died, but there could be people that really got other challenges. People can get tethered cords, they get paralysis, because if you just come and step on my back and the bone has slipped, that has moved a little bit forward, and you just step, chances are high that you are going to tether the cord, a spinal cord, and anything below will never work again. So you find someone, they stepped on the back last week, then the next 2 weeks cannot control urine, cannot control feces, has incontinence. So we can't tell, like, it worked for some people, but it was more to do with, it was more like a psychological healing for people, but I don't think it really worked. But yeah, some people say that's psychological healing, but I don't think it works. Yeah, because it has the treatment options have to depend on the conditions that you have. Yeah, if it is lumbar instability, where there is the bones are so weak, like the ligaments are so weak that they are not supporting the vertebral column, the lower back, then your interventions are going to be focused on stabilizing the lumbar region. If it is the vertebral bone that has slipped anteriorly, then it has to be on how you bring back that bone through traction, through the different maneuvers, the different exercises that are available. If it is something to do with a disc prolapsing and putting pressure on the nerves that are running down, so different conditions will demand different interventions. Yeah. So it's important that we identify the problem through the different maneuvers. Yeah.
Now, what are some of the, what are some of the worst cases you have dealt with in terms of the lower back?
Yeah, like I don't think I didn't state it at first, but lower back pain can be acute or chronic.
Oh, yeah.
For acute cases, it's chronic. For acute, it happens instantly. Someone will come and tell you, you know, doctor, I've been bending. I was just irrigating my flowers, but then I had a pop in my back. I tried to stand, I couldn't. It means the disc has slipped. Yeah, it's like when you bend, the disc will pop. You get, and when that disc pops, that requires immediate management. People will fail to sit, they will not even stand, they will need a wheelchair. Many of them have ended up in surgeries and so many things. So that is worrying. I would say that's the worst case scenario. But then there's chronic low back pain. And for acute low back pain, earlier interventions you will recover so quickly. For chronic, these are people who say, yeah, I've been feeling numb, I've been, you know, but it's okay, I've been able to go to work. So in that way, like you're having ankylosing spondylosis where bones are fusing in the spine. The spine is becoming stiff, the lower back. And for you, because you're able to reach work and go back, you are injuring the back the more. Instead of seeking interventions, you are worsening the problem. And that means it's going to require longer interventions.
Wow.
Yeah.
Wow. That seems like it's a lot to do. Now, who is at risk?
Who is at risk?
Yes, of low back pain.
Of low back pain.
You might also need to spell that out. May I say it can happen to anybody, but you must be having specific categories based on the clientele that you get to see. Yeah.
I'll borrow from the paper that was published by WHO in 2021. They say that anyone is a candidate for low back pain, provided you are aged 30 and above. The most prevalent, it's most prevalent between 50 and 55. That's where the most of the cases are. It's more common in women for certain reasons. I'm not saying that women suffer back pain more, but that's according to the paper. And the disability will present from 80 years and above. So it's basically any one of us at some point can have back pain. Like I've said, at least any one of us has suffered, any individual on the face of the earth will suffer back pain at least once in their lifetime. So it's important that you identify which type of back pain or what is the problem that's causing the back pain. Yeah.
Now for the women, is it because of, because at least I know, if this is the curve of the back, their posture will change over time due to the weight when they're pregnant and having to support. Some of them actually have noticed end up staying with a permanent posture where their back will not get back to being straight, and they will always have that slouch backward. Am I right?
Yeah, you are right. But I think maybe to defend that paper, why women suffer more. And to be honest, I love mothers
too.
So, but they need to know why it's more common. At least one patient asked me, but doctor, why is it that we are only women here? But one, women do most of the chores at home. And their work, the work they do at home, and this is to be honest, they do most of the chores at home. And those chores involve a lot of bending, repetitive movement of the spine, like mopping, sweeping, that breastfeeding, what. So it's they carry the pregnancy, yeah. And when those muscles stretch because of the fetus that you are carrying, they are weakening. And when these abdominal muscles weaken, or when they overstretch, it affects the stability of the spine. Are we together?
Yes, yes.
When you are carrying a pregnancy, there is a spreading of the abdominal muscles, the rectus muscles, and that it's very difficult. In many mothers, they require physiotherapy interventions to regain their strength and the muscles to regain their tone as it was before the pregnancy. So probably that contributes so much to reasons as to why mothers they are at risk of developing low back pain more than men. Another thing is the hormonal changes. The hormones that that will develop, I'm trying to relate so much to why mothers suffer a lot. The hormones that will prevail when you are pregnant, they are all aiming at relaxing the muscles so that you have a normal delivery. Yeah, in preparation for the forthcoming baby. And whenever your fascia, the muscles like relax, it affects the stability of the spine, and it causes instability. It causes a lot of movements in the spine, in the lower back. Also, the baby will put pressure on the vena cava, leading to venous congestion, and that can sometimes cause back pain. Yeah. Yeah.
Wow.
Yeah.
Now, I'd like us to get into some of the ways you manage and you handle, because I wouldn't like to call it treatment.
Yeah.
It is how do we manage low back pain?
How do we manage low back pain?
Because I know as a physiotherapist, if somebody comes to you, there are different interventions you use to ensure that the back gets back into its normal shape.
Yes. Yeah, like I've said, to manage low back pain, one, I'm looking at a scenario where a patient comes to me and is reporting that I have back pain, whether referred or self-referral. The first thing is to assess you. And when I'm assessing, I'm basically taking you through different positions, bearing in mind that I'm looking for the possible cause of your back pain. Now, through the different maneuvers, through the different positions, we majorly use positions and also tasking you to do certain activities. Because, like, I mean, if I've been playing football and then I get a back problem and I can't kick a ball, chances are high there's something wrong with my back. If I've been lying on my back, but I can't lie on my back. If I've been lying on my tummy very well without any issues, and then you tell me, this is debilitating, I just can't be on my back, or on my tummy. I can't lie on my side. So when we try to relate with the structures of the spine, then when we find that there are different maneuvers that we use, there are different treatment options that we use to manage low back pain. There is exercise therapy, there is electrotherapy, there are manipulations which people call massage, there's hydrotherapy, there is lumbar stability, there is traction. So it is based on the problem that we have identified. You can come to me and I fix your back pain, minus even massaging you, minus even touching you.
Okay.
Yes.
So I'm going to ask Glosh at this point to play some of those clips. When we look at them, then doctor, you're going to be able to identify for us, Robert, what this particular manipulation is and what exactly it does. Because at least you were able to send me some beautiful clips of what was exactly going on. Glosh, I would beg you to play through some of those clips, my dear, and let's see which of these therapies is which when it comes to dealing and managing low back pain. Okay, now let's take a look at what exactly is that and what was happening. That particular person is a young man, as you can see, but he has difficulties in bending and turning.
So it implies that the back is a little bit stiff, and he's finding it hard to do certain movements of the spine. So what we do traction, and traction is simply to try and cause a disruption within the spine, to try and pull those vertebral bones apart. It's based on your weight. So there are different, we shall take your weight, and there are different parameters that we have to enter into the computerized machine that will do the traction. So don't say we are not trying to pull you apart. So it's based on the weight, and we cause a pull in your spine. We open the spine, and in that way we improve flexibility of the spine. So it's one of the treatment remedies. Now, for you to come to that, you have probably undergone through different maneuvers, like massage, where the muscles are relaxed, so that when I'm pulling, they're stretchable. For you to come to that, I've managed the pain, because he came with pain because of the fused spine. Pain was running down the leg. So we have used the TENS therapy, which is an electrotherapy modality, to manage pain. So by the time you come now for that particular one, we are using hot packs.
Hot pads.
Hot packs.
Packs, eh?
Yeah. Usually, when muscles tense and they become so stiff, you just need to improve circulation through them. You just need to open the pores and improve circulation through the muscles. That alone relaxes the muscles. It induces relaxation. And the reason that's why we use hot packs is because they penetrate deeper.
The heat.
Yeah, the packs will penetrate deeper, and someone will have improved circulation within the tissues.
Wow.
Yeah.
So heat also has a part it plays in terms of that.
Yeah.
Now there is another one I'm getting to see. Tell me a little bit about the importance of like walking on a treadmill.
Yeah.
Why would anybody want to walk on a treadmill like now?
Yeah. First of all, the treadmill is leveled. The ideal, it's just, you have to walk at home, you can walk. But now for someone who has come into the clinic, is not even walking, probably someone has just been gotten off the wheelchair, you're not just going to tell the person, you can climb the hill. Now, when you are walking on a stable or a leveled ground, we are able to see the mobility within the spine vis-a-vis how you came into the clinic. And it's good for us to be able to tell you how long you should walk at home, what distance you should cover. We are able to see your potential. Yeah.
Okay, that's quite interesting.
Yeah.
Now, I am amazed to see that. So that means by the time you brought somebody to get into walking onto the treadmill, it has taken a bit of some time.
Yeah.
At what point do you use the radiotherapy?
Because
I'm seeing, I don't know, for me, my observation is like, how different is it from the hot packs that you have been using?
Yeah, like I've said, the hot packs and the...
Josh, please, we would like to see a bit of the radiotherapy that's going on. Okay, yes.
Yeah, maybe to collect it, it's not radiotherapy. It's infrared therapy.
Infrared therapy, rather, yeah, infrared.
Yeah, infrared is superficial. You want superficial skin, underneath the skin. The heat should not penetrate deeper.
It's on the surface.
Yeah, some people have pain that is deep where like these tissues are fused like a ligamentum flavum, where the ligaments that are close to the spinal cord are the ones that are tensed. So you need deeper penetration. But infra, it's below the red light, so it's not that penetrative. So, but it gives a divergent beam, so you are able to cover the entire back. Yeah.
At what stage you use it? At the stage when you have examined and you realize it's a more of like...
Yeah, it's important that now for the hot packs, they are targeting a specific area. But now it doesn't make sense for me to just come and work on the lower back, then the following day you come presenting with upper back. So yeah.
You go the whole...
Now, after the hot packs will be localized. So they will be for local pain, for that particular spot. And we want it to penetrate as deep as it can. Now, before me manipulating you, I need to improve circulation on the entire back. Because after fixing the lower back, I need also to also try and also align the different vertebrae of the different parts of the body, like the neck region. And the reason as to why I think you have heard many people saying, I went for a massage, but my friend, I feel pain. I feel more pain than I went there. Simply because some of those people will not first improve circulation. And what they will do in massaging, they will be teasing tissues. They will be inflicting more pain, yeah. So, for us, before we manipulate you or before we massage you, which many people really understand and appreciate, before we massage you, we have to first improve your circulation. We have first be able to arrest pain using the different treatment modalities. And now the infrared, the tense therapy, the traction are what we call the electrotherapy modalities that we use in physiotherapy. There are quite many, like ultrasound, quite many, addressing different conditions.
And
but
at what point do you use, I've seen and I've heard of these, if it's an issue to do with the nerves as well, because like we said, many other issues can affect the lower back pain. How do you deal with the issues of the nerves, because it's rather
it's the most debilitating, yeah. I think what happens with low back pain in many cases that does not involve nerves. When it involves the nerves, it is very painful, and it's when the tissues inside are pressing on the nerves. Like you can see here, the nerves are exiting the spine to take information from the brain.
Which are the nerves here now?
The nerves are the yellow ones.
These are the yellow ones.
Yeah, these are the nerves, and they are exiting. Take it that there is a cord running, the spinal cord, bringing information from your brain. The brain will tell you, slap Robert. For you to effect that, the nerves have got to power the muscles for you to be able to do that. When you get a stroke, you can't. Even when you think of slapping me, you can't. Yeah, simply because the nerves are paralyzed. You are paralyzed, so you can't. The information cannot be relayed. Now, it's like walking. If I'm to walk, probably to come to you, I have to think about it. The brain will plan, the muscles which are going to be involved, such kind of things. And that is done by the nerves. The nerves are our pain signals.
Okay.
Now, any changes or disruptions within the spine will cause pressure on the nerves. The problem can be direct on the cord, where the nerves stem from, or it can be on the nerves themselves. It can be when there is arthritis of the spine. That's inflammation of the spine. And because the bones are wearing out, the debris is falling onto the nerves, and the nerves are complaining. It could be that the ligaments are inflamed, like a ligamentum flavum, and is entrapping the nerves as well. Yeah? It could be that the disc, this cartilaginous disc, rubber-like structure within the spine that enables us to rotate, to turn, absorb cushion and all that cushions the bones so that the bones don't impinge on one another. It can slip, like a prolapsed one, like the one I told you, where someone bends and just feels a pop in the back. It can pop and it puts pressure, like you can see here. It can put pressure on that nerve. So, as a physio, I have to first ascertain how your pain is manifesting. It could be radiculopathic, where pain is running down your leg. So, I have to try and move your spine in a sense that at the end of the day, pressure will be alleviated from the nerve. I don't know whether I'm making a point.
Yes, without damaging.
Without damaging the nerve. That has something to do with the positions that you take. When the different exercises I'm going to give you, because these are musculoskeletal problems, that means I'm also supposed to use your body to alleviate them through the different positions that I take you through. For instance, it could be that by you standing and extending your back backwards, you are causing more pressure and causing more damage on the nerve. You are making the disc even to protrude more and press the nerve. And all you need is probably to bend forward so that you open the spine and allow the disc to go back in its position. So it has something to do with what is causing pressure on the nerve, because the nerves will just be complaining. Unless when you have a tumor and there's neuromas, and that's when you do MRIs and CTs and we are able to tell. Yeah, but in most cases, and that is dependent on how you present. Because if you present to me with incontinences, urine is just, you can't control it. The first thing will be, you know what? You need to do an MRI. And when you do it, we see the image, we refer you maybe to neurosurgeons for operations, depending on how you present. Yeah.
Then, in terms of, I like the way you have clearly spelled it out, and I think we get now to appreciate the value and the importance of every single bit of our body. You know, we never get to see some of these things, and still when you still start having problems, that's when the alarm bells hit and you're like, hey, my goodness, what's just happened?
Yeah.
Now, in terms of still managing, you have talked about it well. How many times should one visit? Because there are also times I have seen some of the manipulative methods they'll use, to a point that I got to appreciate there are times when they have used even the elbow.
Yes.
And I've seen a situation where they run the elbow across somebody's spine. I've seen situations where they'll do a bit of, there are different manipulations, I guess, that people use. Yeah. So maybe how, you know, best is it? Because there are times you would see that somebody, they're touching them even just, you think it's light, but the person they are working on is saying, Banaga, the pain is too much, or it's getting radiated there. Yet, you see the manipulation is very light.
Yeah. I think, I don't know, I've not seen someone using elbows and is a physio to massage somebody. And like I said, for us, they are manipulative techniques. Why I said they are manipulative techniques? Because it's all massage, but it's a hands-on treatment. So the way you deliver your massage, we call them manipulations, the way you deliver that. We have what we call finger pad kneading, where I will use my finger pads to massage you. If I'm massaging, if I want to open these spaces, I'm not going to do this because it's about me opening. So I have to use my pads. If I'm massaging on the shoulder blade, then I have to use my palm.
Okay.
Yeah, and that's all kneading. It's kneading massage or kneading manipulation. Then there are grades: grade 1, grade 2, grade 3. It's all dependent on how you deliver, the pressure that you use. There's percussion, where you need to just percuss and relax. Yeah.
That one like this.
Yes. There's cupping. Those are all different manipulative techniques or massage techniques for people out there to appreciate. But it is dependent on the muscle belly. It is dependent on the problem. So those techniques are employed depending on the problem. Yeah, and when someone is saying, when you are doing those techniques, they should not inflict pain, because growing up, we grew up knowing I need a massage to relax myself. So these manipulative techniques should be in a sense that you relax while they are being done. There is no better way of getting it better by making you cry.
Because I've even had others say, when they went for their first physiotherapy, the first round, or the first time they ever went there, they come out of there first feeling pain. They had to take painkillers. When they went for the second session, it's a lot better. By the third session, maybe the body is getting used. I don't know.
Okay, there are situations where you get out, like you have said, you get out of a session and you feel pain, because we have disrupted the way the body has been orienting, the position that the body has been adapting to, which is not normal. Because these are chronic, some of them are chronic cases. Like, you come to me and you are telling me, you know what, doctor? For the last 2 months I've been feeling pain, but I thought the thing will go. But now I reached office, I could not even do this. It means there is a sense in which your body has been adapting to that. You sit in your car, there's no backrest, someone drives like this. You get? And he's driving, and he's used to that. So the muscles are used to that.
Yes.
So when I'm doing the maneuvers and I'm telling you the exercises and I'm collecting the problem, chances are high that you might get some little pain or pain simply because I'm getting the body from the muscles or ligaments and the other structures of the lower back to a position that they should attain. Yeah. So that pain is acceptable, but it shouldn't be. It shouldn't be that you get out of a session and you are narrating to Sophie that, you know what?
It is worse.
The physio massaged me and I felt like dying on a bed. That is not right. So there's acceptable pain where I even tell you that when you feel this pain, please don't take painkillers. Yes, we tell you that, and you go bear the pain such that tomorrow you are able to report. Otherwise, you will come to me and say, doctor, I don't know whether what you did or the painkillers are the ones which worked. So you can't tell. So we want to see how you fare with the session. But like I said, I think it's more than for people to first appreciate who a physio is, and so such that when you are saying a physio, you really went to a physiotherapist, not our colleagues.
Then are there certain conditions that worsen, maybe medical conditions that are bound to possibly worsen or cause lower back pain?
Yeah, like I said, cancers, because they lead to osteoporosis, which is loss of bone density and weakness, and bones become brittle. It's very painful. Yeah. There are other conditions like endometriosis, the inflammation of the endometrium. It's quite many causes, many other issues that can lead to that, to back pain also. Okay. Yeah.
So how do you deal with a situation like that?
They manage the presenting, that is now for specific, the 10% I talked about, specific back pain, where you can relate the pathology that is causing the problem. And now it requires the doctor, the orthopedic surgeons, the neurosurgeons to address the cause of the back problem.
At what stage, in terms of when the lower back pain has been affected, would you recommend surgery?
Like I said, it's a difficult one for me because there's nothing like a stage. Like I said, it is about how the symptoms are presenting. If you have got incontinences, like the slippage, I'll use just the slippage of the vertebra, which we call spondylolisthesis. It has grades. Grade 1, below 25. Grade 2, above 25 to 50. Grade 3, 50 to 75%. Grade 4, 75 to 100. Above 100, you'll just be dying. So physio can fix that condition to 75%. Beyond 75%, you need a surgery to collect those vertebrae in their position, back to their positions. The degree of slippage, it can no longer be collected by manual techniques. Yes.
Then at what point I've seen people, I don't know what it's called, the one that they wrap, it's like
the belt.
The belt.
Yes.
At what stage does one use a belt? There's some people have seen who get comfortable wearing, and they feel like if they have to do long journeys, then they have to wear the belt to hold the lower back in position.
Yes. Like it goes back now, the condition is lumbar instability in most cases for those people. Some of them it is disc prolapses. That when I sit for long hours, the annulus ligament, the ligament that protects the disc in its position, is weaker. So when I sit from here to, let's say, Arua, in a car, I will reach when the disc is prolapsed. It's important that you put on a belt to stabilize your spine until you reach there. Though we recommend that you do exercises to tone the muscles, to be the muscles to hold the spine, not the belt. Because by you using the belt, it's okay for you to use it when you're going to travel, when you're going to move on roads which are not quite good. It's okay for you to use the belt. But the best option would be do the possible exercises for that particular condition that you have to strengthen the muscles, such that it's the muscles to hold the spine in its position than the belt. Because by you sticking on a belt, you are compromising the muscles the more. Because you are making the brain not even to command less. Already there is a supportive structure, the belt. So the muscles are useless. So instead they keep on weakening, and they get flaccid. So they can't. A time will come when they can no longer contract, and you can only live with a belt. We have seen many patients who come with belts, and we have gotten them off the belts, and they're okay. They dance, they do what? Yeah.
That is interesting.
Yeah.
Now, I would like us to use just like the next few remaining minutes for you to be able to tell us how can we keep our lower back safe.
Yes.
Yes, because at times you could share a tip of you of
Yeah.
how we can keep them safe.
Yeah.
And not wait to the point where we have to have issues.
Yes.
Yes.
There are quite a number of things that you have got to do. Like I said, you look back at the causative agents. What causes the back pain? Posture. Be mindful of your posture. Sit straight. You sit upright. Avoid slouched position. You spend hours on a computer like this. 2, why sit for long hours? It's recommended that when you sit for an hour, you do a 5 seconds walk. 5 or 10 seconds within the office. Get up and try to stretch a little bit. Because the more you sit, you're affecting the center of gravity. So all the weight is concentrating here and you're damaging the lower back. Yeah? 3, do physical activities. Try to do a walk every evening at least. Try to do a walk every evening. 3, avoid the things like putting a wallet in your back pocket. When you put a wallet in your back pocket, a big wallet, or some people who are loaded huge sums of money, bundles, it shifts the alignment of your spine because one side is going to be higher than the other, and that affects the biomechanics of the spine. Yeah. So and above all, seek out, try to once in a while visit a therapist to identify whether your back is okay, because there are other causes like degenerative causes. As we age, there are changes that are happening within your spine. Yeah. Do some swimming, things like that. Yeah.
Oh, that's a very good one.
Yeah.
Now that I find it quite interesting that you have almost like covered it and said it all. So, and you've clearly told us what type of physio is best in terms of the therapy. What type of physiotherapy is best?
Physiotherapy,
depending on the age, maybe. Or you said it depends on the condition.
Physiotherapy is a treatment in its sense. It's a hands-on treatment. Everything we do, we are working with you. And every treatment is better depending on what you're working on, depending on the challenge that you have.
How do you manage to deal with some of, because there are certain times we want quick results.
Yes,
and
yes.
people get frustrated along the way. And then the others will tell you the challenges of, because with each visit, there is a cost attached to it. How do you manage?
I think it's something to do with explaining and understanding what you're managing. And the most important thing is to making the person appreciate the problem. Because even if it were, there's nothing that you can equate to health. There's nothing. Because look, you might say that physio is quite expensive. And probably I'm charging a session at 50,000. Let's say I'm charging at 50,000 a session. But I'm going to manage you, let's say, for 30 sessions in 3 months. And that will be equivalent to 900,000, I guess. 900,000 if I have my mathematics right. And I will have fixed the problem. Then you say that it's very expensive. And then you can't meet that cost. Then you wait, you sit home, the discs keep on protruding, and you go for a 37 surgery. Which one is expensive? It's going to be fixed, but even after the surgery, you'll even have to come back for physio in most cases. Because the surgery is nothing without physio. It affects your, whoever does a surgery, at the end, a surgery is a collective procedure. You are collecting a problem. And after it, you have to get back to function. And it is physio to get you back to function. So why not? Which one is cheaper?
Physio, definitely.
So it has to be with, I think, of course, that one, everyone will say it's expensive, it's what, you don't get results and what. But like I said, if someone has got an acute low back pain, you just need to fix something maybe in 2 weeks. Because it's not a chronic problem. But if it's something that's been there, and it depends on the number of visits also. After the assessment, you might even need to come for physio once in a month for just a session. And you are going to, it's just something for you to keep doing. And, people choose where they want to go and what they want to do about their health.
Then what about a scenario where somebody feels they're a little bit better? This is my final question to you. Somebody feels they're a little bit better and they default And they don't see why should I
go back
for the other remaining sessions.
Yes.
After all, I'm feeling a lot better, right? After the first 2 or 3 sessions.
Yeah, you cannot stop someone, but we emphasize why you need to visit. And like I said, I will tell you that, you know what, Sophie? You have sciatica. We are going to manage it. You'll come for the first 3 weeks, twice, each week. Those are 6 sessions. Then after that, you'll come once. Chances are high that by the time you get out of this room, you'll be better. So I will tell you what you are going to feel and how it's going to be. There are people whom you will tell that to come for 3 weeks and they will come 2 times. And it will take a month or 3 months, minus even getting any symptoms. The time the disc prolapses again, they might even bring them in wheelchairs. But what like, I mean, the best, you are not going to tell the person, why did you come back? I told you. This, you know, you start from there. You say, now, the other time, you are meant to come 2 times a week. Now, with this presenting symptoms, it's going to take us a little longer. Yeah.
And more extra days possibly.
Yes, so people just have to, it's a choice. Like, and quite many patients are responsive. People love health, my friend.
That is very good to hear.
Health is a beautiful, life is a very beautiful thing.
Okay.
Yeah.
Doctor, I know many of you avoid your titles. They don't want to be called doctors. I don't know why. I think maybe it makes them feel closer to us when we use the actual names. But I would like to say thank you so much, Iga Robert, for the education you have shared with the public now. I would like to tell the viewer right out there, please value, and take whatever information has been told to you in terms of how to keep your back safe. The lower back is very, very delicate, I'll tell you, my friend. I have not had a scenario where it has had to go hayway, but I do know what he is talking about because I have seen some people go through that kind of pain. So the tips are very important, and I would like to say he's really shared it and put it out very well. I cannot re-echo or say anything. I believe you have been able to walk the talk with him and been able to enjoy the few minutes. Now, we're just about 6 minutes to the top of the hour. I'd like to say good night from me and from Robert Iga as we wait for the 10 o'clock news in just a few minutes by Lauren Kazimoto Masika. Good night.